So peritoneal cavity, not your stomach. Your stomach is here. You eat your food, food goes into your stomach, which is over in this area. This is your peritoneal cavity. The cavity that contains the intestines, the gallbladder, the liver, the pancreas, the intestines. And what you do with peritoneal dialysis, we use this membrane in order to filter your blood. The surgeon places in this catheter based on your belt line, where you wear your skirt or your pants. So he can put the catheter either above your umbilicus or below. So this dummy has his below. Okay? This is placed in also by a surgeon. First of all, let me be stress clear that this is a very aseptic technique. You have an area in your home where it's very clean, you're washing your hands before you even connect yourself. Your body is washed, your hands are washed thoroughly. We try to keep these clean. They have to rotate it every time. See, we don't want it kinked. See how it kinked up? We don't want it kinked. So you have to keep it in a way that it is loosened. Okay? That's not good English, that is loose. Because the fluid goes in and it comes out. So basically you have to create an access site. Just like for hemodialysis, we had to create a site. And then you connect yourself to this device. And what you do, this is the draining bag. You take this, and usually this solution is hanging up on a pole. But for demonstration's sake, you're going to take this, take that off, take this off. All the solution drains out into this draining bag here. And when it's finished draining, it sometimes takes 20 minutes to drain. The peritoneal cavity, we put a solution of dionyl. And this solution actually is a sugar type solution. Now we get into some chemistry. What happens is that the sugar content goes into the blood system, and by an exchange process, diffusion process, the toxins go out and now into the cavity. See, you got to know that chemistry. So a solution, you have a little hook that holds this solution, and then you take off, I'm going to pretend you my hook.
Okay.
And then you take off. He has the site really clean. You have a special area in your house where you clean. You have all your solutions like this. You have your area where you have your gloves on. So I don't have any gloves right now, but you put your gloves on when you're doing this, or wash your hands before you do this.
Wash your hands, then put your gloves on.
And then you clean off this site. Clean this off. And then this fluid drains into your abdomen. This is usually about 2 liters. And when it's through, then you hang up a new bag, which is about 2 liters, and then it will fill your peritoneal. And when this bag is empty, and now onto your peritoneal cavity, you disconnect yourself. And then you either put this back in your panties or your underwear, put your clothes back on, and go about your business. You clamp it off, you disconnect this, let it go. Go about your business. This dwells for 3 or 4 hours based on how good your membrane filters. So what it is that instead of using an artificial membrane, you're using the membrane lining of your peritoneal cavity. And that's exactly what it is, it's a peritoneal cavity. So this is why it's called peritoneal dialysis, because anatomically, this is called your peritoneal cavity. So after 3 or 4 hours, then you come back to your room that you have designated for your PD, not for your cats, not for your dogs, not for your kids. You reconnect it, and then all the toxins now drain into this bag, okay?
Okay.
So this is called a drain time. It takes about 10-20 minutes to drain all the fluid. Okay. When you had it up, it's called the fill time, which a good catheter that works takes about 15 minutes. And then when we had disconnected it, that's called a dwell time. So one peritoneal cycle is a fill time, 10-15 minutes. Dwell time, 3 hours, maybe a little more, a little less. And drain time, 20 minutes. There's various mechanisms or various stages. For example, you can have this extension, instead of being hooked up to a bag, you could be on a machine at night, which is called a cycler. And this extension will go all the way into your toilet. And on the cycler, you will have about 3 5-liter bags on top of that cycler warming it up. And you have an extension with 5 of these connected to your perineum. This will clean a lot more toxins because look how long you're going, either all during the day or just all night while you're asleep. I like this method because it's longer. That means it's going to clean more toxins. I save your arms. I just told you conditions of where I will use it more. I just said people that have diabetes, who have autonomic neuropathy, meaning that when you're going from sitting to standing, your blood pressure drops. So I will use that. People who have had heart attacks, who cannot take the fast pace of a hemodialysis, I would recommend peritoneal dialysis. Those who have vascular disease from their diabetes. See, I answered your question.
Mm-hmm.
Those who have vascular...
Nice to repeat it in clear cut.
I know. People, thank you. People who have vascular disease from their diabetes or peripheral vascular disease from hypertension, again, their arteries or the vessels are scarred up. So we cannot even create an access in their arm. I would recommend peritoneal dialysis. And also those who just want a better lifestyle. They want to be able to, they work. They want to play tennis or something. They don't want their arms messed up because they lift in boxes all the time. So they rather do peritoneal dialysis. Now I have some patients that rather do hemodialysis because they don't want to be responsible for doing their own treatment. We train them. Peritoneal dialysis nurses train them how to do the peritoneal dialysis in their home. Some patients are afraid of that. Some patients are young and they have their children and their children are always jumping on them, so they don't want a peritoneal dialysis. Some of them like to go swimming, so they don't want to go peritoneal dialysis. Personally, if I was to go swimming, it would be my own pool where I can use my own disinfectant. Okay? So that's brief in a nutshell the difference between hemodialysis versus peritoneal dialysis. I'd like to thank my panel who has made me slow down and explain it in more detail. Future nurse, mother peritoneal dialysis, future certificate. I don't know, this lady went to school for so many certificates. She's going to pass me up pretty soon. So I thank very much them for participating and asking excellent questions that I think everybody will want to know. So if you have any more questions, post it below. Of course, I'm not going to answer everything in one session, but this is a start. And I'm trying to reverse this. So you don't have to go on peritoneal dialysis nor hemodialysis. The more of my blood that gets clean, I know that's better for my health. Cutting my time on this machine, I know it's death. All I know is I don't want to be here. And so what? Cutting my time is death. But like the first 2 letters in dialysis, DI,